Okay, gang. So this is the second video with cystic fibrosis. We're going to go ahead and work on, first video we already covered what is it, manifestations, or effects in the different system. And then this last slide that we did on the other video was discussing changes that you're going to see. So how do we test for this? Well, you can actually start testing for it before the baby's even born. You can start with genetic testing. This has to be both in the mom and the dad. If that's not done, then you can do an amniocentesis. Remember, those happen after 16 weeks, I believe, after 14 weeks. Either or, the baby, if you have a positive amniocentesis, it is likely that your baby is going to have cystic fibrosis due to the gene already shows up by 12 weeks. If they are already born and we suspect it for some reason, we can test for the presence of IRT, which is an immune reactive trypsinogen testing. And then if that's positive, then we would do a sweat test ×2. However, the sweat test is basically making them sweat and then testing the sweat to see if it's abnormally salty, abnormally high levels of sodium and chloride. However, if for some reason the baby is already born, we can do these other tests to check it out. However, most of the time these symptoms show up before the infant is 2 years old. So usually it's 75% of the diagnoses are already made by the time the baby reaches 2 years old. So remember, these are some testing. So you would anticipate, know that for the test, you would anticipate these diagnostic testing for the baby. Sweat test or sodium chloride sweat test, fecal fat test, because we want to test, remember that we just said that pancreatic enzymes help break down fats and proteins and carbohydrates. So if you have abnormal, we want to do a fat test because we want to see if we've got an abnormal amount of fat in the stool. You can do LFTs or liver function tests to see if those are affected. Fasting blood sugar, that's going to be more so if you suspect the development of type 1 diabetes due to changes in the islet of Langerhans. Chest x-ray, look for changes, atelectasis, beginnings of bronchitis and emphysema. Sputum culture, that's going to be pretty hard to obtain though. And then overall pulmonary function tests. So the easiest ones to get are the sweat test, the fecal fat test, and the chest x-ray. So anticipate those diagnostic tests. So remember, our goals of treatment, we can't prevent this. This is by a recessive gene trait. There's nothing we can do about it. So our only thing we can do is manage the symptoms, and this is done by a combination of surgical, pharmacological, and non-pharmacological interventions. Our biggest things for these individuals is respiratory hygiene. Respiratory hygiene is good hand washing, good clean environment, reduce exposure to air irritants, secondhand smoking, those kind of things. Say you have a wood stove in your home. This is something that's very popular where I'm from. In the wintertime, in addition to oil for heating, we burn, or gas, we burn wood. So that would be something to teach about. Good respiratory hygiene. Second thing is nutrition. A well-balanced, high-protein, high-carb diet. So not necessarily simple carbs, but complex carbohydrates. And then, again, our collaborative treatment is surgery, pharmacological, and non-pharmacological interventions. Okay, I wanted to talk about this a little bit more. So surgery, things that we can do for surgery would include things like if you had nasal polyps, removing those. You can do something called endoscopic lavage to remove, help remove secretions via an endoscope. Supplemental oxygen, sometimes if they can't get enough say with the combination of the difficulty in breathing plus the GI upset, a feeding tube is sometimes needed, so it's not uncommon, especially if they have an exacerbation or a bowel obstruction, to utilize some kind of feeding tube apparatus, an NG tube. Some of these people can even get PEG tubes if needed for long-term nutrition, and then a bowel resection at times, again going back to that constipation and intussusception, those kind of things. And then pharmacological, let's talk a little bit about those. So first of all, we're going to have a lot of pulmonary medications. Our biggest thing is going to be bronchodilators and mucolytics. So bronchodilators, talking about our albuterol stuff, Preventil, Ventolin, those kind of medications to help open up the airways and help get rid of secretions. And one of the things that these are commonly used with is chest physiotherapy. That's what CPT stands for, is chest physiotherapy. That's like a massage and kind of loosening or shaking loose of the secretions. And then it's supposed to be mucolytics, not mycolytics. Anti-inflammatory agents, CFTR agents. They actually have come out with some CFTR modulators that actually treat, instead of just treating the symptoms, can treat the issue at its source. However, they're new, they're very expensive, and not everybody has the money for those. And then antibiotics, especially, again, people with CF, I've still got it in my head, it's such a children's disease, use it with, end up using a lot of antibiotics as they get infections. And then remember that anytime there's air trapping, we're going to use oxygen with caution, because we don't want to induce oxygen toxicity. And then you can actually administer digestive medications, pancreatic enzymes, H2 receptor blockers, PPIs. Make sure that they get lots of water-soluble vitamins. A, D, E, K are water-soluble vitamins, and iron. So if these kids are already predisposed to an iron deficiency, they can also end up with iron deficiency anemia. The thing that I want you to know about pancreatic enzymes, if we think about that, the administration of those are going to be administered with food, right? Because that's what stimulates the pancreas to naturally release them, is when they get a signal, hey, we're eating here. And that's when pancreatic enzymes will normally be released. So that's when we want to administer them, is with food. So respiratory care, we really want to do chest physiotherapy before meals. And the reason for that is to get rid of secretions so they can, and help them breathe easier so they can eat. Just like with COPD patients who have poor nutrition because they, it's so hard to eat because it's either breathe or eat, breathe or eat. So they're going to do that. Nebulizer treatment, it's best to do nebulizer treatment with the chest physiotherapy to help increase the amount of secretions we can get rid of. Coughing, cough and deep breathe, exercising, anything we can do to keep that mucus flowing. As far as nutrition, high calorie, well-balanced diet, they need anywhere from 110 to 200%, so almost double the recommended dietary allowances for calories. So if for me that's 1,500, for them it's going to be 3,000. And then sometimes these supplemental feedings and acid suppression, the pancreatic enzymes every time they eat a meal or a snack, water-soluble vitamins, the A, D, E, K, and then make sure that during the summertime especially, remember we said increased sweating equals increased sodium loss, may have to do increased dietary sodium. I know we're always like, sodium's bad, sodium's bad. In this particular case, especially when a child or a person is experiencing excessive sweating, they need to replace that lost sodium. And then they need to be monitoring their stools. So the reason for this is, again, we don't want to see any frothy stools that have lipids in them, or fat, globs. We don't want to see stools that are green with bile that indicate things are just going through really fast. We don't want to see stools, on the other hand, that are just, they're only going once a week and they're hard. Look at Bristol, the Bristol stool chart. We don't want to see any kind of constipation or anything like that. So they need to carefully monitor their stools. So just some things to think about. Kind of interesting is about now that we're living longer, and as we increase the life expectancy of pretty much everyone in our population, is this puts a greater strain on the healthcare system overall. So this is kind of an interesting thing to think about. Who's going to take care of them? Insurance, employability, all that kind of very interesting kind of questions. That has nothing to do with the test, but it's just FYI and some things to think about. So anyhow, that concludes the cystic fibrosis one. So remember everything that's affected. Remember your symptoms. Remember how to manage these. What do we target? We target prevention and management of symptoms. Testing. Remember that, especially after birth, these are our primary tests. Remember that meconium ileus is one of the first things that you'll see in a newborn. Remember that nutrition is so important. High calorie diet, high calorie. Doesn't seem right when we always stress low calorie, lean meats, all this stuff, but high protein, high calorie diet, water soluble vitamins. Make sure that when we administer pancreatic enzymes, we're doing it with water. Make sure that if we're doing chest physiotherapy, try to do it before meals, and make sure that you administer with a bronchodilator. And what else did I want to make sure to go over? Again, monitor stools, and make sure during the summer, excessive sweating or water loss, we need to increase dietary sodium, okay? All right, that's all for this video.